Okay, hello everyone. You're very welcome to our Student Services vodcast for December. This month, Student Services is focusing on personal safety. And today, I'm joined by Tony Duffin, the CEO of the Ana Liffey Drugs Project, to talk to us about the issue of recreational drug use. Tony, you're very welcome, and thanks so much for joining us here in CDCFE today.
Thanks, Denise. It's a pleasure to be here. Thank you.
Tony, I suppose, first of all, I just wanted to ask you if you could maybe just give us a little bit of information about what the Ana Liffey Drugs Project is and what it aims to achieve.
So Ana Liffey Drug Project was the first drug service to be established in Ireland based on the principles of harm reduction back in 1982. I wasn't here then. The idea around harm reduction is to respond to people's active drug use, people who are using drugs, and keep them as safe as possible whilst they are using drugs, whilst also looking for opportunities for change. So that we stay engaged with people, we keep them as safe as we can, and we talk to them, and we look for opportunities for them to make healthier choices around their drug use, their life, etc. So that's it in a nutshell, really. I mean, we do work with people who are who would be known to have problematic drug use. So there's non-problematic drug use and problematic drug use, and we'll talk about recreational drug use in a moment. But we work predominantly with people who have problems with drugs. That said, we do work when prior to COVID, when we had festivals, music festivals. Ana Liffey does go, or did go and will go again, I'm sure, to music festivals and provide welfare and advice to people around how to stay safe when they're using their drugs. Yeah.
Okay, thank you very much for that, Tony. And now that we're in the month of December, it's party season. So, and you mentioned there about the use of recreational drugs. Could you maybe explain what recreational drugs are and why they're used?
So I mean, one definition of recreational drug use would be that it's when people use drugs without a medical justification, like so psychoactive substances, and I suppose in the belief that it's kind of occasional and it's non-problematic. So things like alcohol, which is a legal drug, psychoactive substance, and then of course there's illegal drugs like MDMA and cocaine and cannabis and such, and it's recreational drugs is that it's when people are using them for a psychoactive effect that has no medical justification, and I think it's generally, people think that perhaps that it's doing no harm, that perhaps it's just for a laugh, and it's not addiction or dependency. Of course, I will have very clearly say to people that all drug use is risky. Recreational drug use is risky behavior. And we'll get into that again in a minute, but there are consequences to our actions. And they can be, people do take drugs because they enjoy them. It would be wrong of me to sit here and say, why would people do drugs if it was all bad? They believe that they are having a good experience and they are using them, but there are risks associated to drugs, and that's why we try to, because look, I mean the ultimate negative outcome for people taking drugs is a fatal overdose. But there are many more harms before that can arise around physical health, social impact, impact on your career, impact on your college work, etc., etc. So there's a lot of risks associated to recreational drug use, but that in itself is what recreational drug use is. It's this idea that people are using drugs, psychoactive substances, that has no medical for no medical reason.
Okay, and just what would you say the most commonly used recreational drugs are, particularly among, say, the 18 to 30-year-old age group?
So it's going to be things like cannabis, ecstasy, cocaine. They're the kind of top three. But then there are other drugs that people use. So more recently, we've seen in the media nitrous oxide or laughing gas, people doing balloons, and to get this kind of drunk-like effect, that very short-lived inebriated effect that provides. That's what's called a dissociative drug. Feeling kind of disassociated to reality, sort of thing. Magic mushrooms, people still take mushrooms. That's a psychedelic drug. There's things like GHB, which would be, or benzodiazepines. These are depressants. Other types of drugs. I mean, these are benzos are benzodiazepines, and people they're generally prescribed by a doctor, but people use them for other reasons, to get a buzz off them and such. Methamphetamine, stimulants, heroin, codeine. So these are opiates. So I suppose I've named all these because there's a raft of drugs out there. It's a bit of a minefield, and people tend not to just use one drug. They may use multiple drugs, so what we call polydrug use. And the best example an example I can give of that in terms of recreational drug use, which is quite common, is the use of cocaine and alcohol. So alcohol being a legal drug, and cocaine being an illegal drug. But people, going out on a Saturday night or a Friday night or whatever it might be, and taking cocaine and alcohol, and the two together metabolize in the body to create a thing called cocaethylene. And cocaethylene is more harmful than either one of those drugs in itself. So you can see that, and that can more damage to the heart. Alcohol is a depressant, and cocaine is a stimulant. So people feel invulnerable, but also disinhibited. So the behaviors can be quite difficult or quite outlandish. And that can cause difficulties for people, in the moment. So there are harms associated to that kind of drug use where you're taking more than one substance, and they can be social harms, they can be health harms, they can be legal harms as well.
Okay, and just on that, what would the legal implications be, we'll say, Tony, of being found in possession of any kind of illegal drug?
So we would all be aware that I think that prohibition is the law of the land. That the Misuse of Drugs Act 1977 has been in place for decades now. So if you are found in the possession of drugs for personal use, there will be a consequence, a legal consequence to that. Or if you are found in possession of drugs for supply, then there's even more serious implications for you. Now, I won't go into all the different types of outcomes, because it really depends on the circumstance. So certainly for possession, for personal use, it certainly depends on the circumstances, the judge, etc., etc., etc. But I would say that you may, if you are found in possession for personal use, you may get the Probation Act, and that in itself is not a criminal record. However, I certainly, when as an employer, would look for guarded clearance for people, and people's Probation Act does come up. So it does have an impact in that way. It shouldn't, I don't think, but it does come up. So people need to be aware of that. And yeah, I think that if you do get a criminal record, then it's going to limit your life options. It's going to limit perhaps a job you want to get. The place you want to travel to, for example, the US. If you have a criminal record, particularly, any criminal record, but particularly for drugs, you'll find you won't be allowed in. So and there are other implications, but I think they're the ones that spring to mind. So I think there's serious consequences to being found in possession of drugs. I hope that explains.
Yeah. And if I like say if I'm going out on a night out and
Yeah.
I know I'm going to use drugs, what factors should I bear in mind to reduce the risks to my health? You mentioned there about damage to the heart, about safety risks and so on. What
Yeah.
would the general kind of guidance be for somebody?
So yeah, so
Decision.
I think the first thing to say to everybody is it's always safer not to use drugs at all. Okay, that is a given. But if you do decide, and people do decide to use drugs, then we have a set of guidelines, I guess, around harm reduction to try and reduce the harms to yourself. So the first one would be for people to know the source of where they're getting their drugs. So getting drugs from strangers that you don't know is riskier behaviour. So ideally, in terms of the evidence, knowing where you're getting your drugs from, and obviously nobody can tell you that a drug is safe, that you bought it's an illicit drug, and that you are taking a risk by purchasing illicit drugs. But there is evidence to suggest that having a regular supply reduces that risk. Avoid using alone. So if you're going to use drugs, stay with trusted friends who can support you if anything goes wrong. Tell them that what you've taken, what you're planning to take, so they can seek help if anything goes wrong. Okay, so that's really important. So I think that's something that parents often say to their young ones when they're going out the door. If you can't be good, be careful. Look after each other. Don't leave each other. If someone's intoxicated, then you don't leave them. You look after them. So always look after your friends. Start. Again. As I said, it is safer to not use at all. But if you are going to use, then start with a small test dose of whatever the substance might be, and leave at least 2 hours between the use. There's no safe dose of illicit drugs. Start with the smallest dose possible in order to see what effect you are getting and try to avoid adverse effects. So really be very careful. Use one drug at a time and never mix with alcohol. I referred to that earlier. It's this idea of polydrug use. So use one drug at a time so that you're not increasing the risk to yourself. Don't share drug paraphernalia. I haven't really gone on to that idea as yet, but people use things like what they call tutors for snorting cocaine. They can have particles of blood on them, which can put you at risk of say, hepatitis C, for example. So there's serious issues. People often think of needles and sharing needles, but any drug paraphernalia that is being used has a potential to have, say, blood on it or whatever, and spread bloodborne viruses. So be very, very careful. And then carry condoms. So using drugs and alcohol can increase your sex drive. Always carry a condom in case you choose to have sex, and I think being under the influence of whatever drugs you're using can increase your sex drive and also can sort of you might not be making the best choices in that moment. So having a condom with you is really important. So, yeah.
Okay.
I think. Sorry, just one more thing. I think just what I was thinking there. If you or a friend are unwell due to drugs or alcohol, call a medic. And what I mean, so if you're at a house, call an ambulance. If there's no medic available, if you're at a venue, go and get a member of staff, find a medic immediately, and get help straight away. You won't get in trouble if you for looking for help. Because when it's kind of an interesting one. If you've taken drugs but you're not in possession of drugs, when you can't be arrested. Okay, so look for help, and the medics would rather that you sought help and got help, so that person has the best possible chance of not having a negative outcome or a fatality.
Is that something that people worry about, Tony, that they're afraid of contacting the emergency services because they've ingested drugs themselves? And
Yeah, I think so. I think people think that they're going to get in trouble. I think that, and you know, if you aren't in possession of an illicit substance, you're not going to get in trouble. But for having taken and being under the influence, and it's really important to tell the medics what you've taken as honestly, absolutely honestly, what's believed to have been taken, so that they can make a really quick, informed decision as to what intervention they may need to do.
Okay. And Tony, what would be the signs, say, that I might be developing a problem with recreational drugs? So how would I know if I'd moved from, say, what I might say in inverted commas, normal drug use into maybe problematic drug use?
Yeah, so the way we talk about it is non-problematic drug use and
Yeah.
problematic drug use, and that shift from things, the perception or the reality that someone has gone from non-problematic to problematic drug use. I think people need to listen to their loved ones and their friends. They'll often get feedback very quickly around their drug use, and I think that can be really helpful, but not always heard by the person. I think that the negative sort of the impacts will be things like not meeting your obligations, for example, right? It might be around work, it could be about college work, and it might be about family, it might be about relationships. So there's a kind of health, social, and of course criminal justice. You might get in trouble with it. That might be the first time you realise that actually, I think I've got a problem with drugs because now I've been caught in possession or whatever it might be. And I think those kind of parameters, when you think about drug use and the negative consequences of someone's drug use, it could be about, as I say, health, social, or criminal justice. And I think that it is quite a wide range of what could be the indicator, and it also depends what the person thinks. Obviously, is a problem. For them to then go look for help, because obviously it's a problem if you're damaging your heart. Obviously, it's a problem if you've developed sort of severe anxiety, but the person might not see that, and it's trying to get people to come around to the idea that actually, you're going to need a little bit of help here to rectify the situation. So it's a challenge, all right, to get people to sort of think about their own health, and people feel really invulnerable. Quite often what people will think is, well, that happens to other people, that's not going to happen to me. When in fact, of course, everybody feels that way, and of course, negative impacts do happen to people. Listen to your friends, listen to your family, think about what is happening in the course of a week when you're going out. Are you getting up in the morning? Are you getting to your course, your classes? Are you not making it to work? That kind of thing. Have you had to go? Have you ended up in an A&E? Have you ended up having to see a doctor because of your drug use? These are all indicators as to whether it's become problematic drug use.
Okay. And finally, Tony, I just wanted to ask you, if you are in that situation where you feel that your drug use has become problematic, where is the best place to go to get help?
If you have a GP, I suggest you go straight to them. And quite often, your GP will have known you for many years, and they will know the family history and et cetera, and talk to them about your concerns, and they'll be able to make referrals and things, and depending on what might be needed. It might be counselling, it might be a medical prescription, it might be a referral into treatment and rehabilitation. But if you don't have a GP, my advice would be to visit drugs.ie, the website, drugs.ie. They have a national directory of drugs and alcohol services for Ireland, and you can look there to see what's available in your area, and contact a local service. There's also across the country we have national drugs. We have drug and alcohol task forces. you can always contact the local drug and alcohol task force to try and see if there's anything, what else it might be available to you. But the first port of call is always your general practitioner.
Okay.
Yeah.
So, Tony, thank you very, very much for all of that really useful and valuable information. And if the name of the website to visit, you said there, if you could maybe just say it again, drugs.
Yeah, drugs.ie.
Drugs.ie.
Yeah.
For all information on resources and information.
So you'll find information there about types of drugs and what they do and the risks and the harms and such that the different drugs do in terms of, I suppose, being informed about the risks. And this is the thing I suppose I try to leave you with is that some people think that the drugs are good and some people think that drugs are bad. But the truth is that all drugs are risky to greater or lesser degrees. That will depend on the type of drug, the route of administration, how you take the drugs, the potency of the drugs, your tolerance to drugs. So drug use is risky, and people need to be informed about what they intend to do, what they are doing, and where to get help. And if you visit drugs.ie, that's where you'll find a lot of information.
And they gave a list of all the different types of drugs that you mentioned earlier and possible side effects and damage that they might do. Okay.
Absolutely.
Tony, thank you so much again. It's been a pleasure to have you with us today. And that's it then for this week from the Student Services podcast for Coláiste Dúlaigh. Stay safe.